like to call upon Dr. Mulidhar Sharma sir, STM CAODP, to take over the session. Welcome to you, sir.
Okay. The next part is about the fluid and electrolytes and consequences, emergencies produced due to impairment of the fluid and electrolyte balances. Uh, the first, before we go into that, we'll direct have some idea about how that fluid and electrolyte balance is maintained and what are those issues. The bit of a very brief about the physiological aspects of the fluid and electrolyte assets. The major component of the human body is having fluids, and in adult males, the solids is around 40% and the fluid is around 60%. Whereas in adult females, it's almost equal. The fluid and solid components are almost equal. Among the fluid there, we have intracellular fluid, which is present within the cells, and then the interstitial fluid, which is in between the two in between the tissues, which constitute the major component of the fluid as such. Then the plasma, which is the circulating fluid in the blood. Now, the blood as such, what we see in the circulatory system, it constitutes around only 4.5% of the total body volume, and among something around 20%, 15% of the total fluid in the body. So major component of the fluid will be intracellular within the cells, and then interstitial in between the cells in the tissue space. Of course, there is a slight difference in the ratios of the fluid and solid in males and females. The solid components are proteins, lipids, minerals, carbohydrates, and a few more as such. Whereas the fluid, the mainly the fluid quantity is, or the fluid is supported by the water intake. Now, the fluid which is gained into the body and the fluid which is lost, there should be maintenance of the balance. Then only the net amount of the fluid in the body can be maintained as such. Fluid is absolutely necessary. Water is absolutely necessary in the body for all basic life functions, including the all biochemical reactions, the transport of the metabolic products, transport of the nutrients, and all activities, and even to maintain the shape of the cells, the water is necessary. So water is one of the essential component. Now, in general, in a whole body, the input of the fluid would be mainly from the food as such, fluid which is consumed as liquid, and then some certain amount of the water is produced in the body during the metabolism, like a glucose metabolism, it results in 6 molecules of water. So that's about the fluid which is added to the body or input as such. The output is in the form of urination or sweating which is either visible or invisible. Then evaporation in the lungs. As you breathe out, there will be some amount of the water contents present in the air breathed out, and the loss in the feces. Now, whatever the quantity which is mentioned here is just an average, but on an average, it's around 2.5 liters of the fluid which is exchanged daily in the human body in an adult. Now, the along with that fluid, now it's not only the water which is important. The water is maintained in these compartments like the vessels or maybe the intracellular compartment or extracellular compartment due to the presence of the electrolytes. The electrolytes which are mainly present in the body are sodium, potassium, calcium, and magnesium. They are the positive charge, the cations. Whereas the anions, the negative charged ions, are mainly chloride, bicarbonate, and phosphates to a certain extent. Protein also acts as a negative charged material, though it's not an ion. It's not an electrolyte in that sense, but it helps in maintenance of the fluid and electrolyte balance. Now, the concentration of these ions or electrolytes in the plasma, in the interstitial fluid, and the intracellular fluid would be varying, and due to that difference in the concentration, the fluid is kept in that compartment. Now, the when sodium is kept more in the extracellular space, more of the sodium, the ratio of The sodium in the intracellular space and the extracellular space is around 1 is to 10. See, for 14 milliequivalents of 14 millimoles of the sodium in the intracellular, it's around 142 in the plasma. So, and similarly, the negative ions, more of them would be the chloride which is in the extracellular space, and the chloride in case of intracellular space is lower. Whereas potassium is primarily intracellular, the concentration of potassium in the intracellular space is around 140, whereas the plasma extracellular space is around 4. So, and similarly, bicarbonate ions, the intracellular space is around 10, whereas in the extracellular it's around 24, so almost double. Now, this kind of a difference is maintained continuously, actively, by an active energy consume mechanism of pumping out the specific ions and as well as pumping in the specific ions, so that along with the ions the water also is exchanged, and hence that quantity of the water is maintained. So a maintenance of the water in these specific compartments is always related to the electrolytes, and hence whenever we speak of the fluid and water balance, we speak of water as well as electrolytes. It's not alone water alone. So water is dependent upon the electrolytes. Mainly the most important ions which are necessary for the fluid and electrolyte balance are sodium and potassium. Calcium, magnesium also have a role, but their role is something more than that. But most of the important thing is sodium and potassium. So most of the times, whenever we discuss about the water balance in the body and abnormalities produced with the water contents, we always give more importance to sodium and potassium. Now, how this fluid is maintained are the exchange of the fluid as well as the electrolytes across the cell membrane in the intracellular and extracellular. They are of the three varieties of mechanisms. One is the diffusion. Diffusion is a where there is a, because of the concentration difference, simply passively the electrolytes tend to move in and out through the cell membrane, the pores of the cell membrane. It's a passive process where it tends to move towards the concentration, lower concentration from the higher concentration area. So there is always a tendency for the sodium to move in, because the concentration of the sodium in the extracellular space is more, whereas the potassium tends to move out, and this is prevented or this is regulated by active, and that's what we call as a facilitated diffusion. Now, if at all this facilitated diffusion is not there, then there would be a situation where the concentration of the sodium inside and outside the cell would be equal. And when it is so, that cell cannot survive. So there is a need to keep this actively pumped out or maybe pumped in the potassium by an active diffusion, or that's what we call as a facilitated diffusion. Facilitated diffusion is only the selective electrolytes are allowed to move in and move out. In addition to this, there is another of things like what we call as the active transport. Active transport is selectively due to the presence of specific receptors by consumption of the energy. The substances are actively pumped in or pumped out whenever there is an imbalance. There is a tendency for a change in the around the environment. That change in the environment is nullified or neutralized by an active utilization of the energy. So something, the energy which energy is utilized, and then the electrolytes are pumped in and pumped out with effort, which needs an active energy of the cell. So if the cell is in a healthy condition, then only this mechanism can be functioning. Whereas if the cell is not in a healthy condition, it may not function. Whereas a facilitated diffusion is also what we call as by semi-permeability. That it depends upon the size of the pore and doesn't require an active energy to the same extent as that of the active transport as such. Now, in general, to be making in brief, fluid compartments are separated by membranes that are freely permeable to water, and movements of the fluid due to that there is a tendency for the movement of the fluid to move in and move out due to one is the hydrostatic pressure. Hydrostatic pressure is which is exerted by the heart As the blood moves in the circulation vessels, there is a tendency for the fluid to be pumped out of the blood vessels into the tissue space. And in the venous side, the fluid tends to move from the extracellular space into the vessels as such, a vascular compartment. So there is one force, in addition to what we have discussed as at the cellular level, the other force which keeps the fluid in and out is the hydrostatic pressure. Another force which maintains is the osmotic pressure. Osmotic pressure is in the circulating chamber, that's in the vessels, we have the insoluble substances, not the electrolytes. Insoluble substances like the proteins, particularly uh, albumin, particularly albumin, and this albumin doesn't go through or doesn't pass through the cell pores or membrane, these capillary pores, and due to that, the when the water leaks out, water goes out due to the hydrostatic pressure, the osmotic pressure increases at the venous end of the capillary due to that osmotic pressure because the concentration of the albumin or maybe the proteins is increased, the water is sucked in. So this mechanism, a balance of the hydrostatic and osmotic pressure, maintains the fluid within the circulatory system because the circulatory system is the main gateway for the fluid to enter into the body. Whatever you have consumed water, in terms of maybe the fluid consumed or along with the food, it enters into the circulatory system first and then it reaches to the extracellular space and then into the intracellular space. And the primary source for the water would be from the circulatory system, and in the circulatory system the fluid is maintained by a balance between the hydrostatic and osmotic pressure. Then, of course, the fluid which reaches to the capillary end, there due to the capillary filtration, it's a hydrostatic pressure only. The fluid leaks into the cell space, and at the venous end, it will be press are sucked by the osmotic pressure. Interstitial hydrostatic pressure, that's the pressure which is in between the two cells or in the tissue, also would be facilitating the fluid movement. Like when you sit, the weight of your body acts upon the tissues, and that weight of the body would be displacing the fluid from the interstitial space to the exterior, and hence the amount of the fluid in the area could be slightly lesser, and once that pressure is released, again it may come back to the normal. And then of course the tissue colloid osmotic pressure also is one of the mechanism. Now to the same which we have discussed would be is demonstrated in a sort of image as such. When the blood moves at the arterial end, the arterial side, hydrostatic pressure pushes the fluid out, and at the venous end of the capillary, the blood, fluid moves in. In a ideal situation, the pressure of these should be equal, but practically these may not be equal due to many other variable factors. So whenever there is some excess of fluid left over, that excess of fluid left over in the interstitial area is sucked by or drained by lymphatic drainage. Ultimately, that lymphatic drainage adds to the venous end, and hence that circulation is maintained, and hence the total body water compartment is maintained integrally. So that integral maintenance of the water compartment is a major function of the circulatory system, and the circulatory system is the one which source through which the fluid enters into the interstitial space. The exchange of the fluid in between the cells and the interstitial space, intracellular and interstitial space, is maintained by the electrolytes, the balance of the electrolytes. And this is the same thing, same which I have discussed in terms of another image, so that it can you can make out exactly what it is. Now, if at the intracellular or at the tissue area, if there is a variation, what happens? If the in the normal situation, extracellular fluid and intercellular fluid are in balance, and hence there is a compartment. The solutions are there is a balance. The fluid, there is a continuous exchange. The ratio of exchange is maintained in the normal situation, and for making you understand this clearly, this picture shows that the reddish color for the intracellular fluid, and extracellular fluid as a greenish or bluish color. Now, if at all one of the compartment, the fluid in one of the compartment is affected, it results in the involvement of the other compartment too. Suppose if there is a water loss from the extracellular fluid compartment, the total volume of the extracellular fluid compartment gets reduced, and it results in a situation where the electrolyte concentration of the extracellular fluid increases. And as once this becomes more concentrated, there will be more of diffusion or the osmotic pressure exerted, and there is it results in a situation where the intracellular fluid also gets reduced. So it's not that only one compartment is affected. If one compartment is affected, the other compartment also is affected. If there is a fluid loss, reduction of fluid in the extracellular compartment, the intracellular compartment also will result in a fluid loss, and this fluid loss results in an imbalance of the electrolytes. See, because there is the water is lost in the extracellular compartment, and the electrolyte concentration increases, and this electrolyte concentration, increased electrolyte concentration, attempts to make the concentration equal between the intracellular and extracellular, and hence there will be fluid which leaks from the intracellular compartment to the extracellular compartment. To maintain that balance, during that, it's not the water alone which is lost. Along with the water, the concerned electrolytes also would be sucked in, and the effect would be in the intracellular compartment. Ultimately, the life function is depending upon the cell intracellular compartment, and once it is affected, you will see the consequences of the what we call as water loss or dehydration. Now, what happens is, if there is such a mechanism, if there is a fluid loss in the body or changes in the fluid loss as such, the balance is maintained by the body by various mechanisms. Now, one of the mechanism of that maintenance of immediate attempt to maintain the fluid in the body as a whole, in the extracellular as well as the plasma fluid, would be by reducing the sweating. So reducing the sweating would be, or once that is yeah, of course, once the fluid is lost in the body, the first of the thing which the body tries to get over would be try to reduce the sweating. So thermoregulatory ability is a maintenance of the body temperature would be affected. So body temperature tends to get reduced, so that the perspiration is reduced as such. Then the next, if the fluid loss is still more, then the muscular activity will be reduced. Muscular ability to maintain the tolerance or the capability of the muscles to act will be reduced. Muscle strength also may be reduced in during as such, and it's seen clinically as a heat cramps as such, what we call as heat cramps as such, as a clinical symptom, as when it is around 4 to 6% of the fluid is lost, particularly intracellular. In the muscles, if the intracellular muscles, the fluid in the intracellular compartment is reduced by around 4 to 6%, you will have that the strength of the cell would be reduced in case of the muscles. Similar situations would occur in the other cells also. If it is around more than 6% of the intracellular fluid is lost, it results in heat cramps, heat exhaustion in case of the muscles. As the whole body, it can result in coma or death. So intracellular fluid is ultimately is a deciding factor about the fluid loss. Now, normal hourly fluid requirement, what we need to maintain that fluid would be, there should be regular supply of the fluid. Now, a normal hourly fluid compartment, regular supply of the fluid, water to the body, to maintain that balance is in a person who is having 5 kg weight, it's around 20 milliliter per hour. Now, you calculate the total requirement of the water required by a child having 5 kg weight. Whereas in a person having 90 kg body weight, it's around 110 milliliter per hour. So requirement of the body water is mainly dependent upon the body weight. In addition to that, the other factors which decide about the quantity of the water required would be the temperature in the area, sweating, whether there is a sweating or not, that needs to be compensated. And if the temperature is raised, similarly for every 1 degree centigrade, you have to increase the water quantity by around 10 ml per hour. And and particular body temperature, when you have febrile, when you have fever, the quantity of the water intake has to be increased by for every 1 degree centigrade, 10 ml per hour need to be added to the quantity. It's also related to the physical activity. When you are doing more physical activity, that physical activity also requires more water. So what we have shown here is only the resting conditions, average activity, not resting, average activity, and average standard temperature, normal body temperature, and environmental factors also are not so severe. When there is a very severe dry environment, the water intake has to be increased. And if it is a humid environment like rainy season, the water intake may be slightly lesser. But on an average, this is the amount of the fluid which is required to maintain that balance as such. Now, once the fluid content is reduced in the body, the plasma content is reduced, then there is a homeostatic mechanism attempt by the body to maintain that fluid balance. And this homeostatic mechanism would be of different varieties. Like, say, the one is if there is a fluid is maintained normally, the quantity of the fluid is slightly reduced. The first of the thing would be it tries to increase the extracellular fluid by osmoreceptors. The osmoreceptors are stimulated, and that results in ADH secretion, and the ADH secretion results in the reduced urinary output so that the fluid is conserved. The mechanisms of the body to cope up with a temporary fluid loss would be the urinary output could be reduced, or if the fluid is more, the homeostasis is increased, sodium level is reduced, water intake is more. Then at that time, the ADH is reduced, the urine loss would be more. So this way, it can maintain the balance. Similarly, sweating also is regulated, respiratory rate also is regulated, so that the rate of fluid is maintained and the quantity of fluid is maintained properly. Now, if the fluid loss is more, that results in what we call as the dehydration. And it's a well known dehydration. The clinical signs of dehydration are well known. And there is a real fluid loss which is beyond the capacity of the body to maintain with the homeostatic mechanisms. That results in the excessive fluid loss, resulting in one is the excessive sweating. Of course, these causes for that loss would be excessive sweating can result in the dehydration, or inadequate intake of the fluid can result in the loss of the fluid, or loss of the fluid in forms of vomiting, diarrhea, or the abnormalities of the urination, polyuria, can result in the dehydration as such. Signs of the dehydration, well known. The first of the thing which we see in a case of whole body, the signs of dehydration will be the elasticity of the skin will be reduced. Sweating will be reduced. It results in dry skin and the skin elasticity reduced. And hence, when you squeeze the skin seems to be shrunken, and the tissue turgor or elasticity of the tissue will be lesser. Then the next part which you see would be the total urinary output would be reduced. Oliguria would be the other signs. The impact of that tissue, intercellular space fluid reduced, will be seen in the eyes being sunken, and there will be tachycardia. Tachycardia, the body's compensatory mechanism to cope up with the fluid loss would be by pumping more fluid, and hence the pulse rate would be increased. So there will be tachycardia, tendency for the blood pressure to be reduced, and as the peripheral vasoconstriction occurs, the peripheral tissue will be blanched out. So you tends to have a pallor-like appearance. In child, the fontanelle would be sunken, and it can also result in the altered consciousness levels as such. So the mucous membrane becomes dry. That's how the clinical signs of fluid loss or dehydration are seen. Now, based upon the clinical signs of the dehydration, we characterize them into three categories: mild, moderate, or severe. In a mild category of dehydration, the capillary refill time is not much affected, heart rate is slightly increased, and urinary output may be slightly reduced. Otherwise, there may not be any change. The rest of the things may seem to be normal. Whereas in a moderate dehydration, the patient's consciousness would be slightly dull, lethargic. Capillary refilling time is in between 2 to 4 seconds. The dryness in the mucous membrane is visible. Tears and ink decreased, or any sort of other fluid loss other than that of the urine also would be reduced, and all that typical clinical signs like sunken and fontanelle being depressed, skin turgor being affected, pulse being volume of the pulse being reduced, and, and blood pressure may be normal in a case of moderate dehydration. Whereas in severe dehydration, the capillary refill time would be more than 4 seconds. Limbs tend to change. All those what we have discussed as all those clinical signs would be seen, and the patient tends to become more semi-conscious or unconscious or quite severe dehydration, who is the result of that. Dehydration also can be assessed by the assessment of the urinary color, and there is a standard urine color chart. A dark colored urine seems to be or is the definite sign of a dehydration, because you may not be able to assess the quantity of the urine output in 24 hours in a patient with dehydration. So if you look at the urine color, that can be made out, and there is a standard color chart of the urine assessment for the fluid loss also. And this universal standard which you can see, and compare this with the urine color of the patient, and you can make out the possibility of the urine output. Now, to guess about the quantity of the water required or the fluid loss in a case of dehydration would be, in a case of infants, the main dehydration is around 5%, that's 50 milliliter per kilogram. Whereas children, particularly in pediatric conditions, you have more of these issues. In a very small child, the infant, the fluid loss will be quite significant in terms of the percentage of the body content. A moderate dehydration in a child would be 10% loss, whereas a moderate signs would be seen in a child by around 6%, whereas in an adult, the moderate sign would be seen by around 4%. Moderate sign. So naturally, their tolerance that dehydration changes would be more in adults compared to the children, and in infants is quite severe. So severe dehydration means signs of severe dehydration in a child, in an infant, means around 15% of the fluid is lost. So this is also necessary to plan for the dehydration mechanism. So assessment of the dehydration in a degree of dehydration, the same thing what I have told earlier is the same. Like whenever you have given a fluid, or suppose a patient is dehydrated, and then you have given the fluid, replace the fluid as such, then, and if there is no signs of dehydration, fine. If there is a mild dehydration, still there is a around 5% of the fluid required, and in such conditions, oral fluids would be enough. The patient has to be rehydrated with the oral fluid as such. Then, if the uh, patient has rehydrated and by, okay, all right, now due to some other commitments, I'll have to stop today. I'll continue in the next session with the from this point only. There are some other issues. Right? Okay. Thank you.